Welcome to Compass Opioid Stewardship in Practice. Each week, our Compass coaches will explore a real-world case, define a clinical goal, and walk through practical strategies to improve care. Whether you're tuning in via video, audio, or reading the summary, this session is built for busy clinicians like you. Enjoy the show.
My name is Dr. Christine Blake Smith. I am a family practice, addiction, and lifestyle medicine physician, and I'm also a coach in the Compass Opioid Stewardship Program. This week's case focuses on opioid tapering in a long-term chronic pain legacy patient. The goal is to decrease opioid dosing to improve patient safety and reduce both patient and provider risk, including long-term medical complications and liability. This is a 64-year-old male with a history of traumatic bilateral above-the-knee amputations from a boating accident decades ago. He has chronic phantom limb pain, multi-level degenerative disc disease, and osteoarthritis. He entered my practice in 2018 when his prior provider retired. At that time, he was taking OxyContin 40 milligrams twice per day, plus oxycodone 30 milligrams, 6.5 tablets per day, which is a total of over 400 MME. He was also on alprazolam 100 milligram twice per day. Initially, he wasn't willing to reduce the opioids, but he was willing to taper the benzodiazepine after education about safety risks of opioid and benzodiazepine combination and co-prescribing, especially as he's aging. Over 2 years, he successfully tapered off of the alprazolam completely without needing any alternative anxiety treatment, surprisingly. And he hasn't reported having any anxiety issues since then. He's seen every 1 to 3 months for long-term medication management. At each visit, I consistently shared small, digestible educational points about long-term risks of opioid use and prescribing, including hormonal suppression, opioid-induced hyperalgesia, sleep apnea, cognitive effects, and respiratory depression. And I gently reiterated my recommendation for him to taper when he felt ready. After 3 years of ongoing discussion about it, he agreed to try a very small reduction in his dose. And he chose a time-based strategy, gradually spacing out his OxyContin doses. Surprisingly, within 3 months, he discontinued the OxyContin entirely with no withdrawal and with no worsening of his pain. This success really helped to lay the groundwork for further tapering for him. In 2023, he began slowly tapering oxycodone by half a tablet every few months. He's now down to 60 milligrams per day, which is a reduction of over 75% from his original dose. His pain remains well controlled, and he reports improved alertness, memory, and bowel function. Most importantly, his overall safety has dramatically improved. So here are some key clinical pearls. Tapering is usually a marathon, not a sprint, and that is absolutely okay. You can go slowly. Not all patients can taper off completely, but any reduction improves safety and reduces the provider risks as well. Consistent, brief education at each visit plants seeds that often lead to eventual readiness. If you offer a taper at every visit, even if it's tiny, removing a quarter or half a tablet or spacing doses further apart, patients are often surprised that they don't miss it. Avoid opioid and benzodiazepine co-prescribing whenever possible. Concurrent use of these two medications significantly increases overdose risk, especially in older adults. Long-term use alone is not justification for continued prescribing. Reevaluation over time is essential. Rapport and persistence really matter. Most patients will eventually agree to try a reduction if the relationship is strong and the approach is patient-centered as well. Real-world success stories are really powerful motivators, so feel free to use them even if they're not your own. The Compass program provides opioid and benzodiazepine tapering resources to support this kind of work. For complex cases, we encourage you to reach out to your clinical coach for individualized assistance.
This show has been brought to you through the generous support of the Centers of Medicare and Medicaid Services. Thanks for joining this week's Compass Opioid Stewardship in Practice. Thank you for being part of the Compass Opioid Stewardship Program, and thank you for all you do caring for your patients. See you next time.